Okay, hi everybody. Today on our video, we're going to be talking about basically Botox, all of the risks, the complications, the aftercare. I'm even going to go through a procedure with you guys. I've got a patient that's going to come in and get her frown lines done today. So we're going to go through a whole procedure. You guys can see it start to finish and yeah, get all your questions answered.
So we're just going to do this area right here, right?
Yeah, so we're just going to do this area right here because that's just your main concern.
Yes.
Again, yeah, she hasn't had Botox ever before. And since, you know, it does feel a little bit different, like you'll try and squeeze and contract and your muscles just won't listen. They'll stay exactly relaxed like that. Cool. So it does feel a little bit different. So again, yeah, let's start with one area, see how you do.
Okay.
Yeah, we can kind of go from there. So as far as how long it takes to show up, I inject today. You'll probably start to see a difference by about day 3 after today. 10 to 14 days is when I can really assess, does it work? That's kind of our max effect. And then do I need to top you up and put anything else in? So after that 2-week mark, I can check in with you. If you're happy, you're good to go for a few months until your next treatment.
Okay.
Okay.
Cool.
Any questions at all?
No, I'm excited.
No. Okay, so typically when my patients come in, I see people from all over the spectrum. I see men, I see women, I see women that are women and men in their early 20s, and then I also have a patient who's 90. So it's really all over the map. The most common treatment that I see is this guy. I can also do these horizontal lines up here, your crow's feet. I can do a brow lift as well. Your bunny lines, I sometimes do those, not very common though. A lip flip is quite common with the younger crowd, especially for women who are thinking about lip filler, but they don't necessarily want to do that full volume or commitment, so they just get a little lip flip. I can also do the chin as well, and then I can also do these guys, your DAOs, and that's for women that they're, you know, as we age, your mouth kind of pulls down at the corners. I can inject those, and it kind of helps return the mouth to a nice neutral line and make them appear a little bit younger as well. Okay, so starting with Audrey today, I always like to ask my patients a couple of questions just before we begin, just because there are a few contraindications, a few reasons why I shouldn't inject. First, do you have any allergies?
No.
No allergies? I mean, allergies aren't really a huge concern for me. It's just I need to know if you're allergic to anything that I'm going to use to like clean the area, latex in my gloves, stuff like that. Do you take any medications at all?
I take Xeljanz because I have rheumatoid arthritis.
Okay, all right. The main thing that I'm concerned with are any blood thinners, just because that might make any more bleeding and bruising pop up. And also any like cancer medications, like if you're doing active chemotherapy or radiation, then I can't inject as well. And obviously not pregnant or breastfeeding. No, so that's also another reason why I can't inject. And the reason for that is just there just hasn't been any research. It's obviously hard to get pregnant women to become part of a study on Botox because they don't want to put their fetus at risk. Understandable. So that's why I can't inject pregnant or breastfeeding women. And I think that's pretty much it. You don't have any health conditions that I need to be aware of?
Nope.
No, perfect. So yeah, we're ready to inject. Those would be the only reasons why I couldn't inject her, but we are good to go today. So some typical concerns and questions that patients have, obviously, how long does it last? Typically 3 to 4 months. Again, it depends on your metabolism. There's some patients I have that are like bodybuilders or high-performing athletes. It'll last maybe 6 to 8 weeks on those gals and people, but for most people, 3 to 4 months, and some people even 6 months. Second question is, how much does it cost? We charge $10 a unit. $9 if you rebook appointments while you're here in office, like your next kind of follow-up 3 to 4 months as well. Depends on the area for how many units, and you know, obviously it depends. There's a range of how many units I can inject per area and per person. I like to start conservative, and then if I need to add more, I can, but once I inject some, I can't take any out. So I like to start low and then on the natural side and see where we go from there. And it totally depends on the muscle as to how many units I need. You know, in here we might need 15 to 20. Up here might need 8 to 12. Crow's feet, I kind of start at 5 per side and go up from there. The bunny lines, maybe 1 or 2 units a side. Lip flip about 4. Chin about 6. And then these guys about 6 as well. So it's kind of all over the map, and that's the base. But we can kind of go up from there as well. Okay, so I'll kind of go through risks as well associated with injecting Botox. Obviously, I'm using needles. there's always going to be a chance of bleeding and bruising. I do my best, and especially, you know, the areas that I can see a lot of blood vessels and stuff. There's always the risk, though, obviously, right? I am puncturing the skin. That's kind of the main risk with this area. There's not really a huge amount of other risks. If I was injecting up here, there's a risk of what we call spocking, like Spock from Star Trek, where the outside of his brows sit way higher.
Yeah.
That's not a great thing to do. If I do inject this area, I preemptively put units out here just to prevent that, but there's always the risk that still we have some outside movement. It's an easy fix. I just put a couple extra units on the outside. Okay, and that's kind of the main.
So is this one unit?
So this is one needle. So I can put kind of however many units I need to in here. I like to change out my needles after about 3 pokes, just because then the needle starts to get dull and then it just hurts more for the patient. So yeah, I have only 3 pokes, which I can only use 1 needle, but I just wanted to show you guys what this needle looks like. So these are the Botox needles. These are actually also insulin needles. So these are the same needles that diabetics use for their insulin.
Cool.
So
they're so little.
Very, very small. Yeah.
Oh, nice.
Very, very small. I don't know if you can see that in the camera there. Yeah. Very, very small. I find it is a little bit of a pinch. Nothing too crazy though. Most people don't need any numbing or any ice, anything like that. It's just, it's not even near as bad as, you know, getting like a shot or anything like that. Right? Yeah. Okay, so I'm just going to start by cleaning the area. Obviously, I do this for everybody. It's just a basic chlorhexidine wipe. If you have any allergies, we also have alcohol swabs and a couple different methods as well. So I'll just start by cleaning the area here. All right. And then I always make my white little dots. It's just a method that I use to double and triple landmark check myself. Okay, so just frown here for me. Yeah. Nice deep frown. Yeah, perfect. And relax. I'll just make sure we're equal. Yeah, perfect. Okay, and then the other thing I asked, do you want a squeezy ball?
No, I'm okay.
No, okay.
Thank you.
Some people I just have stress balls just in case people have any like needle phobia, anything like that. Ready to go?
No, I'm so ready.
You're so ready. Okay, so I'm going to start with the one right in the middle there, okay? So just turn a little bit more towards me and frown and relax. And frown and relax. And I'll just come around the other side here and turn a little bit this way, yep, and frown. Frown again and relax. Done.
Nice.
Easy peasy.
That was easy. I love it.
And that's it. Yeah. So they look very normal. You can kind of see a little tiny touch of blood. That's very normal. I'm just getting the white dots off of you here.
Okay.
Don't want to send you out in public with those. So they look very normal. They're a little bit red, a little bit of a bump, as you can see, kind of like a mosquito bite. Typically that lasts maybe 30 to 60 minutes and then it's gone and you look like normal for the rest of the day.
Awesome.
Okay. Yeah, so again, just be mindful about any pressure that you're putting on that area. So no scratching, rubbing.
Don't touch it.
Try to do your best not to touch it.
Okay.
By the time you go to bed tonight, like washing your face, laying on your pillow, totally fine. It's just for the next 5 to 6 hours that you have to be mindful. Sometimes when I put the cleaning solution back on it to wipe the white dots off, then they'll get a little tiny touch of blood. Very normal.
Awesome. It really didn't hurt.
Yeah. A little bit of a poke because it is needle, but
that's
pretty
awesome.
basic.
Thank you.
You're very welcome. Do I have to avoid anything? Yes, you do. Don't exercise is the main thing. You don't want to cause anything that's going to want to make you scratch or rub at your face. So exercise and sweating, or if you're going to go and get a treatment that's going to put pressure on your face, like massage or chiropractic, just for the rest of the day. Avoiding exposure to the sun as well. Again, just it might get uncomfortable and itchy, so you don't want to do anything that's going to make you touch or scratch your face for the rest of the day. On you today, I just put 15 units in, so 1 poke, 5 units, 5 units, 5 units. Totally depends on the person and their muscles. With you, a lot of your pull is right in the middle, which is why I concentrated the units in the middle. Other people with, these 2 muscles, they stick way out and I have to go a lot higher and put more units in. And obviously with men, they have stronger muscles. I have to put more units in them. So it just totally depends on your anatomy and how many units I think you kind of need. But yeah, that's what we did with Audrey today, just 15 units right there. Perfect. So yeah, you've had the Botox treatment now. I'll see you in 2 weeks just to see what it looks like and make sure you're happy with everything. See if I need to put any more in. At 2 weeks, we can also assess if you wanted to do any other areas of your face as well. And then it's totally up to you in terms of when you want to come back. Again, most people get 3 to 4 months. It depends on finances. It depends on your schedule. Like maybe you're out of country and you can't come in for 5 or 6 months, right? It totally depends on you. And then when it starts to bother you again as well. You know, some people I see once a year because they go, you know, they get the treatment done before a vacation and then they wait until the next family vacation or something. Other people I see religiously every 3 months. It totally depends as to when it starts to bother you again.
Yeah, and you said before my body's just gonna, my metabolism will take care of it, right? It'll just kind of slowly, my muscles will slowly come back.
Exactly, yeah. So a common misconception is that your muscles are worse after the Botox wears off. That's not true. You just think it looks worse because you're used to how your face looks with the Botox. So once the Botox wears off and your body just breaks it down, metabolizes it, it goes out through your kidneys and your urine, your muscles go back to looking how they were before I treated you today. You just might think they look worse, but it's not actually true.
Awesome. Thank you.
Let's face it, when you look good, you feel good. Our Advanced Skin Clinic provides expert skincare advice and the latest laser and light-based treatments. Find out which treatments are right for you. Book a free consultation at westsidelaser.ca. Laser, Botox, skin and body.